Two special taping situations require extra care: when compression is needed and when distension is anticipated. There are situations when compression of a site is desired. Unfortunately, some clinicians routinely attempt to achieve compression by strapping the tape on skin, causing shearing tension. Applied this way, tapes with non-stretch backings exert continuous tension along the skin, weakening the connections between the epidermis and the dermis. This may result in blistering and skin tears. Even tapes that have stretch often have memory and tend to pull back into their original shape. This too exerts tension on the skin. Watch. See it pull together there? When tape has been strapped and is removed, weakening of the epidermis may also result in skin stripping. To help avoid these problems, remember that compression is a function of both the tape and the layers of dressing material. You may apply a soft cloth tape, such as Medipore tape, in the usual manner. Just stretch. Okay, or using microfoam tape, place the first section of the tape on the skin without tension, gently pressing downward. With one hand, secure the tape on the edge of the dressing while slightly stretching the next section of tape over the dressing. Secure the tape on the opposite side of the dressing. Then place the remaining tape onto the skin without tension. When done properly, you will note a narrowing of the tape over the dressing. An alternative is to start the compression in the center of the dressing, stretch the tape to either side, but make sure that the tape attached to the skin is applied without tension.
Another special circumstance is when distension, edema, and/or movement are anticipated. If the skin contour under a tape increases and the tape is unable to accommodate that change because its backing does not stretch, the same problems that applying with tension may occur.
If distension is anticipated, use a tape that stretches or a self-adherent wrap to secure the dressing or tubing. Foam tape generally stretches in all directions. However, non-woven soft cloth tapes, such as Medipore tape, stretch in the cross direction and on the bias, but not lengthwise. The direction of the stretch should be considered when securing the dressing or tubing to an area that is at high risk for distension. Anecdotally, applying soft cloth tape parallel to the incision, with the stretch medial and lateral rather than proximal and distal, appears to be associated with fewer skin tension injuries than taping perpendicular to the incision. Reassess your tubing and dressing security every shift and as needed. You may need to change tape more frequently if the area is moist, stressed, or if distension occurs.